Well, tonight, the Department of Health addressed the sudden announcement that another hospital will stop delivering babies, this time the Mayo Clinic in New Prague. But as Jennifer Hoff reports, it's part of a bigger pattern that experts say is putting moms and babies at risk, particularly in rural areas.
South of the cities sits New Prague, a small town whose mayor grew up there.
When I talk to people, they really want that closeness.
A growing community, but one now losing its labor and delivery ward, the second across the state to shutter that service in a month.
You know, the closest hospitals, then you're starting to look at Northfield, Owatonna, Mankato. So then it starts getting to be an hour drive here, an hour drive there, or more.
New data confirms as many as 22 Minnesota hospitals decided to divert deliveries in the last decade, one of the highest numbers across the country, and that includes Boston, Cambridge, Albert Lea, Ely, and Hastings.
It appears here in Minnesota the pace of closures has accelerated recently.
Dr. Katie Casamanal is a U of M professor researching rural health and says severe staffing shortages, declining birth rates, and rising expenses are causing the closures.
And unless we change how we resource and pay for and value the lives of pregnant rural Minnesotans and their babies, we are going to keep having this conversation.
The doctor says maternal services are also under reimbursed and hospitals are losing money. In New Prague, only about one baby a week is born here, and its last obstetrician is also leaving just days after the doors officially close.
Well, it's detrimental for a very small community, and we're lucky to have a hospital here.
The labor ward there officially closing on Friday. Mayo Clinic says patients can transfer to its Mankato campus or, if they want to other closer hospitals in Shakopee and Faribault. Now, state law requires hospitals give a 120-day notice of a change like this, or it could very well face a fine. But in the case of New Prague, it will only be about a few weeks' notice. Mayo Clinic citing an exception, saying the lack of staff there right now, really no staff, is making it simply impossible to continue.